I have seen this only 2 cases for the past 20 years, only 2 cases. Because it's not a human parasite, it is a pig, the protozoa of the pig, but it can cause disease in human. And this is the ciliate. Only one group of ciliate is the Balantidium coli, and the disease we call it the balantidiasis. And the habitat, again, the large intestine. So you should group the protozoa. Right now, it's only one protozoa that causes the sign and symptom in small intestine is Giardia. Others live in large intestine. Entamoeba histolytica, where? Large intestine. And this is another one, the Balantidium coli in the large intestine. So you can group it together. Since this is a ciliate, so it is the same place as Entamoeba histolytica. They live in large intestine, and they can go to the cecum and terminal ileum. So look at the definitive host, mainly in pig, but they can be the parasite of human if they infect human, and they can cause disease. They look cute for me. This is the ciliate, and they have the mouth here. So they will use the ciliate to move very quick. Once they are alive, they move very quickly. And this is the ciliate. It's a very, very large, and I think that some of you, maybe most of you, saw the parasite already in this morning from the demonstration. Anybody else take a look already for Balantidium coli? No, not yet. Okay, doesn't matter. They are big, very, very big. But somebody asked me this morning, the trophozoite has only one nucleus or more. I say most of them have only one nucleus. But this one, the trophozoite has two nuclei. This one we call it the macronucleus, and the other one is the micronucleus. But we cannot see this one. This is so small. They have two nuclei, macro and micro. We see macronucleus here. And the description, we call that a kidney shape. It looks like kidney, a little bit like this. This is a staining of the parasite. We cannot see the micronucleus. Micronucleus is a little bit right here, but we cannot see it. So they have two forms, trophozoite and the cyst. And this is the cyst. The same, they have two nuclei, but we see only one, this one. It is a macronucleus. It's a very, very big, go back again. So once you take a look under the microscope, I think that you remember the morphology of the cyst and the trophozoite. It's very easy to remember, and I hope you will not miss it once it is under the exam, because it's very, very unique one. Once you see the nucleus here, you know this is Balantidium coli, and how big, look at the size. Very, very big. Almost the same as the size of the egg, right? Almost the size of the egg. So this is a very big trophozoite and big cyst, a large size, very, very large. Don't miss it. It's very similar to what you have learned already. I need somebody else to help me right now. Is invasive or non-invasive?
Invasive.
Yes, invasive. you have learned amoeba, ciliate, and flagellate. What can cause the invasive one? This is the ciliate. It is the invasive right now. And how about other protozoa that you have learned already that can invade the tissue? Yes, amoeba. What kind of amoeba? Yes, so you group it together. Entamoeba histolytica and Balantidium coli are the same group that cause intestinal what? Large or small? Large. Yes, that's cause lesion in large intestine. So colitis occur, of course, because of the invasive of the which stage? Cyst or trophozoite?
Trophozoite.
Yes, very good. Only trophozoite can cause the invasive action, not the cyst. Cyst can use for only
transmission.
Yes, very good. He said cyst used for transmission, but infection occur in the large intestine and the invasive one caused by this. And you can take a look at the picture here. You know that they cause the inflammation of the large intestine. So what they produce the enzyme hyaluronidase and tissue invasion. Of course, ulcers occur. What kind of ulcers caused by Entamoeba histolytica? What kind of ulcers? Very good, flash shape. So it means, what does flash shape mean? Yes, tiny at the top, a large area of destruction of submucosa. So this is a flash-shaped ulcer. So the same. So they can cause the dysentery. So what does dysentery mean? Yes, the patient can pass stool with blood and mucus. So Entamoeba histolytica and Balantidium coli cause dysentery because they are invasive protozoa. And extraintestinal balantidiasis is uncommon here. How about Entamoeba histolytica? Common or uncommon? Common. And why this is not common? The same. They cause the same. This is uncommon. What? Same pictures. Invasive, cause the destruction, but this is uncommon. And how about Entamoeba histolytica? Where is the common place of the extra intestinal liver? How about this one? Use your common sense. It's a common sense answer. It's very common, not common. Use your common sense to answer this question. Logic. Use your logic. Simple logic. Which, very good. Her common sense is good. She said the size. Wow, right. She's right. The size is very big. Very uncommon. But we can see it. It means that the patient was very, very, very unlucky to see this kind of extraintestinal balantidiasis. See, they can cause colitis and diarrhea, and they can cause mucus bradydiarrhea. 20% are symptomatics, very similar to amoebic colitis. And this is a hormone, pain and tenderness. And this is a non-specific GI symptom. So this is a very, very similar pictures, the same as Entamoeba histolytica, amoebic colitis. And the complication occur is a peritonitis, not very, very common at all. Bacterial infection, appendicitis. And this is, of course, she explained it already. It's very rare for the extraintestinal balantidensis because of the size. They have cyst and trophozoite. So, how about the symptom, the patient who have symptoms? We're going to see trophozoite or cyst in stool exam. She said both. How about you? She said both cyst and trophozoite. For you, cyst or trophozoite, or trophozoite or only cyst? What? They have symptoms. They have diarrhea. They have mucus bloody diarrhea. You should see trophozoite or you should see the cyst. The trophozoite, the same as amoeba, Entamoeba histolytica. You're going to see trophozoite with what for Entamoeba histolytica? Ingested red blood cell for Entamoeba histolytica. But for this one, what you're going to see? Ciliate, protozoa moving. That's it. You have 5 minutes break. I have only 1.5, and 30 minutes for the rest. So please come back in 5 minutes.